Yo, yo, yo. Hey guys, welcome back to another awesome edition of the Best Practices Show podcast. Are you thinking about next year, 2025? Like, how should things be different? How do I design my practice next year for another big year or better year? Well, today I bring back Dr. Jim McKee, and he proposes there are 5 questions. He called them the 5 most important questions you have to ask yourself as a dentist in 2025. I agree. These are amazing questions. So please listen up. I hope you guys enjoy this, and we'll see you soon. Hey guys, welcome back to the Best Practices Show podcast. I hope you guys are enjoying this as much as I am and we are. Our jam here is to bring you the best thinkers in all of dentistry to help you create a better practice and a better life. And I have one of those people today. He's a regular guest on the podcast, one of my favorite mentors of all time, Dr. Jim McKee. And this could be one of my favorite podcasts of all time. I'm predicting it in advance. He's going to ask you, what are the 5 most important questions you need to answer as a dentist in 2024? Jim, thanks for being back, brother. I appreciate you.
Kirk, it's always a pleasure to be with you. Looking forward to this podcast. How have you been?
I have been fantastic, and I'm going to be even more fantastic after today. You guys know this. Now, I'll bring you into my brain. I love CE and I love dentistry. And so Jim and I have had a relationship for a long time. He's always been a great mentor of mine. He is truly one of the best teachers in dentistry. And so today he's going to bend your brain with some questions. And I'm so excited to examine this. Now, I want you to talk about the genesis of these 5 questions. And let's talk about that before we get into them.
Well, you know, it's interesting. Most of the time as dentists, we focus on the clinical aspects of dentistry. The other side of the coin is that we are business owners. And at some point, we have to be able to run a practice, and we have to be able to coordinate that with the clinical side of dentistry in order to be able to maintain a private practice. So I was really fortunate in the early years when I was really learning stuff. Pete Dawson was a really wonderful mentor to me. Pete talked a lot about the business side, the side of managing staff members, doing all the other things. I was able to learn a lot at the Pankey Institute from Frank Spear, from John Coyce. So I've had wonderful people, and this is kind of an amalgamation of the things that I've heard. But I will tell you, you know, I think a dentist who's been out 30 years would benefit from answering these 5 questions. I think a dentist that just graduated recently this spring could really benefit from these moving forward into their practice. It's going to be a common sense approach to dentistry. And really, I think the 5 questions that I think you have to ask in order to try and have a private practice today that is fee for service, that you can control your own destiny with. It basically kind of is the evolution of the restorative diagnostic practice that we've talked about before in these podcasts. These 5 questions will lead you to the type of practice that you want. And I think when the choices become a little bit more clear, the advantages of the restorative diagnostic practice really overshadow everything else. And ultimately, it allows you to have a practice that really gives you a chance to have balance in your life, to have time for family, to be able to retire at a reasonable age, and to enjoy dentistry. So that's really the kind of the background of how these 5 questions got put together. I just was putting together, this was basically part of a presentation I did for the Chicago Study Club last Thursday. And that's kind of how the whole thought process started, Kirk.
Yeah, I love it. I already know the 5 questions, so I'm telling you as a listener, it's important to think about each one of these, and I wouldn't limit this to 2024, maybe for the rest of your career in Q4, Q3, or maybe even every quarter. Ask yourself these 5 questions. So let's go there, Jim. Where do we start?
Let's start with question number 1.
All right.
First question. How am I going to design my physical plant, and how much space do I need? That really, I think, becomes the core question when you're going to either open a practice straight out of dental school, if you're going to take over an existing practice, how many square feet do you want to have, which really relates to how many operatories do you want to have. You're going to need some type of lab. Today with the digital world, I think lab space doesn't have to be as large as it used to be in the analog world. But I think you have to devote space to a lab. You're going to have printers, you're going to have a wash station, you're going to have a cure station. So those things have to, I think, to be part of today's clinical practice. You'll have a business area, you'll have storage, you'll have a staff area, but really what it comes down to is the amount of space that you need is dictated by one question. How many doctors are going to be practicing in your practice? And basically, how many days per week will each doctor practice? That's really the first question. There's a woman in our study club who has a 4-operatory practice, and there are 2 doctors working in there. Now, they don't work at the same time. So one works 3 days a week, the other works 3 days a week, and they overlap on a day. So there's a number of different ways you can do it. The reason for this question, though, really depends upon your temperament. Are you the person that wants to have a larger group to manage? Do you want to have multiple doctors to be able to work with? And I know many people who have done it, and it's been fabulously successful. I know many people who have done it also, and it hasn't worked out so well. The reason why I ask this question is because, unfortunately, what we see is sometimes we think that we're going to build an office with the thought that we will bring another doctor in. So instead of a 2,000 or 2,200 square foot office with maybe 5 operatories and a consult room and lab, which is basically the practice design that I used, was basically doubled now if you thought you were going to bring someone else in. So maybe now you've got 4,500 square feet. Well, if you find the perfect associate, that's an awesome fit. Problem is, everyone's heard the stories where the first associate didn't work out, the second associate didn't work out, the third associate didn't work out. All for good or bad reasons, doesn't matter. But ultimately now the owner is paying for 4,500 square feet, and they're kind of office rich and cash poor.
Yeah.
So it just depends upon which way you want to go on that, and just be real clear on that. An ideal situation, if you're starting out, might be to start small, and maybe if you can expand into other space, that might be a nice way to do it. But this, I think, is the key question, because it really determines really what your loan for the practice is going to be in terms of equipment, in terms of a monthly lease, or a monthly loan payment if you own the office. So it just kind of depends on which way you want to be thinking about where you're going to go with that.
Yeah.
What are your thoughts, Kirk?
Oh my gosh, you may be in trouble for asking me that question. Now, Jim is brilliant, and I think you're right on target here, Jim. One of the things I want to just get clarification for anybody who's listening. If you're a 34-year-old dentist and you're producing $1.5 million and you have 3,000 patients and you're writing off 42%, I don't think you're saying, Jim, just expand, because when you're writing off that much, you're just making the problem bigger. Sometimes people think, because it's easy to think this way, the bigger, the more profitable, the more I can take off of my shoulders. I don't think you're saying like expand right now. Somebody who's listening to this might say, listen, I need to be asking that question over and over again so that by the time I know myself, I can expand, because anybody that's ever done it, and I have 2 dentists doing it currently that I just talked to on Friday, it is the most stressful thing you'll ever do professionally ever is move from one space to your dream space. And then when you get through it, you're like, oh my God, thank you. I got through it. So I think that's one piece. I'm going to couple this. Number two, I think you do need to know who you are, because I have seen many dentists go to the 4,500 space and they're like, oh my gosh, I don't like all this activity. I don't like all that. I think you got to know yourself. And then one more thing, I'll just ask you about physical space. You didn't say my favorite word, which is consult room. It's amazing the number of floor plans I get. And I'm like, where's the consult room? And they're like, oh, shoot.
Consult room is in my notes on this presentation. Well, here's what I would do. Honestly, if I'm designing an office, don't design a private office.
Yeah.
Make your consultation room in the private office. You really don't need a private office today. Today, you can make phone calls anywhere.
Right.
Everyone has a mobile phone. They don't really need their own space in the office. I think that's wasted space. I think you really got to be careful to really plan your space really efficiently, really ergonomically, really cleanly. And I think if you do that, I think you'll end up saving more space than you thought. We expanded our office after being in practice, let me think now, probably 17 years. And basically, we almost doubled our space. Now, we were lucky. We could stay in our existing space. The space next door to us became open. They could finish the other side. Then all they had to do was to break through a wall. We walled that off. They made some changes on the regular side. So really, it was a very easy process if you have the ability to move into space that's around you. So the other thing is, if space is cheap around you, maybe you get the big office now and you don't fill it and you just have it there. Now, you are going to pay extra rent for that. But again, if your cost isn't that great, maybe you look into that. But I think, as Kirk said, I think really, Dr. Pankey used to talk about knowing yourself. Know yourself, know your practice, know your work, know your play. But ultimately, I think that it depends upon what type of temperament you have.
Right.
Dentistry is one of the few healthcare professions that allows you to have a small business where you are really the only person that you have to account to. Now, the downside of that is you're the only person who's the widget maker. So, it's not all peaches and cream staying small. You got to be there and you have to be able to do the dentistry. So it depends upon which way you want to go. But my point is, a lot of times when we're making decisions, we don't know which way we want to go.
Right.
So I guess talk to other dentists, visit other offices, but get a feel for how you want your physical plan designed and how much space you need, which really comes down to the fact, do I want to practice with someone else at some point, or do I want to maybe stay small and not practice with someone else at that point?
Right.
What's your experiences looking at associateships and partnerships, Kirk?
Well, that would be a whole nother episode. There are people, it's exactly what you said. There are some people that do it really well. I think if I was to summarize an answer, it would be this. The people that do associates and partners well do it from a position of strength, meaning they know who they are, the practice is overflowing, they can see clearly how a new associate is going to pick up the slack. What doesn't work well is when people expand without an associate, they expand from a position of weakness, meaning I only have 1,500 patients, but I'm going to get an associate and add some space because I think if I build it, they're going to come. And what you have is a lot of dentists saying, gosh, I got to start getting this associate busy. Well, then you've got the other side of it. If you find a great associate, I'll just say this, they want to go to work right now and they want to stay busy in your practice. They don't want to be strung along for 6 months going, I know, we're trying to get this place busy enough so that you can stay here. And so I think there's a push and a pull in there. And I would summarize it by just saying expand from a position of strength, if that makes sense.
Well, you and I am sure have seen the same situation where a dentist is busy, but they've got enough dentistry for maybe 1 1/3 dentists,
right,
maybe 1 1/2 dentists. but they don't have enough for two. That's the problem you see with a lot of associateships, and that's eventually why the associate ends up leaving, because they get tired of doing all the pedo, all the endo, all the non-profitable stuff.
Right.
And they figure I'm going to go out on my own and see if I can start doing the more profitable stuff.
Right. Yeah, I think the other thing, and I mean, we could jump on to number 2, is you don't need a partner to be happy. You can certainly collaborate with other people. Say, well, I'm going to get an associate partner because I don't like practicing alone. You can have plenty of fun collaborating, working with other people. You don't need to pay them and make them come into your office. But I'll kind of leave that there because it's a 50-50 split. Some people do it well, some people don't.
Right. This isn't not get big or not stay small.
Right.
It's just knowing what fits you best.
Right.
So just know that answer, because that drives so many other things.
Yeah.
Question number 2.
Let's do it.
How many staff members do I need to hire, and how much should I pay them?
Ooh, unpackage that one.
Well, think about the staff members in your practice. You're going to have a front desk person, probably. Although I have to say there's some really interesting things happening with remote front desk staffing these days. Have you seen any of that, Kirk?
Yes, I have. I've seen quite a bit of it.
What's your thoughts on that?
I think, Jim, you're asking me questions I need 5 minutes to answer. I think number 1, when it comes to people on your team, number 1, it starts with core values. Number 2, I think you should figure out what's your business model and how many people do I want? And then you should always automate, outsource before you hire. If there's something I can automate, let's do that first. I can outsource it. Let's do that next. Like graphic design. And let me just do this. Graphic design. I'll never hire a graphic designer. There's too many amazing, talented people out there that you could easily outsource. But billing, or sometimes hygiene scheduling, or administrative tasks, even some of the administrative, I outsource a lot of those things, and it's amazing how good people are. So I think the point here is you can get creative, because I've seen the same thing you're talking about, Jim.
Yeah. So you're going to need chairside assistants, likely a hygienist. Lab assistant is the interesting one. Again, that was another Pete Dawson idea. And basically what I did is I had a lab assistant that, again, this is in the analog world, but it's the same as in the digital world, quite frankly. Mounted all the models. Today, that would be virtual articulation. She fabricated all the appliances. Today, that would be designing the appliances and printing the appliances. You could do diagnostic wax-ups today. Today, with the ability to print and the software programs that are out there for the design programs, the only limit is your imagination in terms of what you can do with a lab assistant in the digital restorative diagnostic practice today. Seth Atkins is a great digital dentist who's just south of Dallas. I think you've had him on, Kirk, haven't you?
I have not. So we're going to get him on.
You should interview him. He'd be a great interview. And he was just talking this weekend about the fact that it's getting pretty close. We're going to be able to print aligners in the office. So really, it's going to be a game changer in terms of doing aligner therapy to move teeth orthodontically.
Wow.
So I think if I was a dentist today, I would really look at a lab assistant. That could maybe be a 2-day-a-week job and piggyback with a front desk or an assistant for something like that. But I guess my advice would be to have someone dedicated to do that and not necessarily have an assistant who's being pulled away to do that. Give them a time that they can focus on that in the schedule, and make them accountable, just like they're an outside lab. Give them the same critique you'd give an outside lab. When I look back at that from a profitability perspective, that was one of the strongest moves we made in our practice over the years, because really when you start to add up the numbers relative to what it costs to be able to do that, you really can do pretty well today.
Right.
So it all depends, though. You could outsource that as well. You could outdoor design work. So it depends upon how many people you want to manage, how many people you want to train, and that leads to really whether you need an office manager. My feeling was, in terms of office managers, I generally have said this in the past, that I think a single doctor office, that's really adds another layer of bureaucracy and expense to the office. If you're not a good manager and you want to delegate that, that's okay. But here's the problem I've seen with office managers. Many times office managers get that title by default.
Right.
Because they are the most senior person in the practice. A true office manager, I think today, should be someone who's not in dentistry. I would bring someone in who has a corporate or business background. Wouldn't have to be a full-time position. One of the guys in our study club, David Turok, who's a great young dentist in the northern Chicago suburbs, has something like this. It's a semi-retired corporate guy who understands businesses. And I would use that as opposed to someone who maybe been an assistant for 25 years and you needed someone now. A lot of times that's not the skill set that they bring to the office. Sometimes it may be, but I've not seen terribly effective use of office managers in that scenario. I'm not saying it's not possible and it doesn't happen, but I think if you're going to have an office manager, it's probably going to need to be a multi-doctor practice.
Yeah.
If it's a single doctor practice, you're just managing someone to tell the staff something. Why don't you just cut out the middleman and you tell the staff something?
Right.
You know what I mean? You save the salary, you have direct communication with the staff. Honestly, the problem is most of the time we were never trained how to talk to staff, how to manage staff, how to constructively build staff, or how to positively build staff morale. We were never taught that. So most dentists don't like that part of the practice. I'm going to suggest that as a business owner, we need to change that. I think that's something as a single doctor practice. I think that's something you really need to do. You need to invest in your people. They're going to be your largest payroll expense on your profit and loss. Invest in your people.
Yeah.
And if you can do that, I'll tell you, we had fabulous staff who really made the practice extremely profitable because they were able to, as you said earlier, assistants could outproduce hygienists because they were doing spot-on diagnostic work.
Yeah.
So the practice model works beautifully with a really low stress model because all the staff members are trained. They all understand the vision of the practice. They all understand the culture of the practice. And quite frankly, if someone does leave, a lot of the times the staff members have someone they want to bring in because they want people to work in that type of office.
Yeah.
It's been really interesting to look at the culture of a dental office and what an important role the dentist plays in that. You know, the dentist has to be someone who sets a positive tone.
Right.
There's no other way to say it. That's part of our job. I understand that we are all under stress, but when you walk in that door, you're wearing a different hat. You are wearing the hat of a business owner. You are setting the vision. You are setting the tone. You are setting the way the day is going to run. Yep. Set it positively or set it negatively. It's your choice. The obvious good choice is to set it positively. Don't go in and start moping. Don't go in and start complaining. Don't go in and start berating staff members. If you've got something to do, talk to them about it after the morning meeting. Don't start the day like that. Yeah. It's not a positive way to start the day. People feel beaten down. They can't wait to leave. It's no fun to practice that way. Everyone has strengths and everyone has weaknesses, doctors and staff members included. Part of the doctor's job is to understand what the staff strengths are and the staff weaknesses are and accentuate the strengths and try and protect from the weaknesses. That's basically what it comes down to.
Jim, we're going to have to turn this into a full day course. We're doing a podcast on this, but like you could didactically create like a decision tree based on all of these questions. Like,
yeah.
I love it. I love it. What's question number 3?
Question number three, really now that you've figured out your physical plant, that gives you an idea of how many people you need. Now that question three relates to you. What are you going to do and how are you going to get trained to do it? Two types of continuing education, I think. The first are kind of the big meetings. I'll call it visionary education, where you go to the American Equilibration Society, you go to the American Academy of Cosmetic Dentistry, you go to the American Academy of Restorative Dentistry, you can get an invitation. You go to the larger meetings, many times you'll hear multiple speakers, and what it does, it expands your mindset. It expands your vision in terms of what's possible. Now, interestingly enough, I've seen dentists their whole career, and that's the only continuing education they do. People are at meetings every weekend, it seems like. And yet, when you talk to them about their practice, they're very well versed in a lot of different speakers. But the reality is, a lot of what they hear at the meetings is not being done in their practice. There's a breakdown somewhere between the learning and the implementation. I think that bridge can be tied together through study clubs.
Yeah.
So for me, study clubs was the implementation side of continuing education. There's a lot of study clubs you can join today. You can start your own study club. I started my own 35 years ago, basically because I was trying to implement principles that I was learning going through training with Pete Dawson and at the Pankey Institute. It's a great way to learn. You learn with a group of like-minded people, probably with similar training, probably with similar thought processes in terms of practice management. It's a great sharing group. I mean, the study club that we've really developed over the years is such an important resource for the members in it. You have a question, you can put out an email, you'll have 20 answers by lunchtime. So, I mean, it gives you support that you need, because dentistry is an isolating profession. You know, if I'm busy, I generally don't see my front desk person all day. I'll talk with my staff members during procedures. I might have lunch. If I have to do a phone call, if I have to write a letter during lunch, I basically have no time for anything, quite frankly. That's why I think a lot of dentists are drawn to dentistry, because basically a lot of times it's an introverted personality, so that not having a lot of contact with people is okay. On the other hand, if you're extroverted, you need that contact. So again, it all depends upon your personality. But I will tell you, I think the more I see people in dentistry, whether you're introverted or extroverted, I think we need two types of continuing education: visionary education to help expand the mindset, and then study club implementation to put the pieces together on a day-to-day basis.
Yeah. You've often said that study club learning is probably one of the key factors in any great dentist's career. Is you commit to it, you're getting the feedback, you've got feedback loops, people are being vulnerable, you share cases, it's real-time learning.
I honestly, Kirk, I can't think of anyone who has mentored me that's been a really good dentist who wasn't in a study club.
Right.
I mean, all the John Coyce came and talked to our study club twice. Frank Spears run study clubs for years. Pete Dawson, LD Pankey. I mean, really all the giants in the profession back at that time ran study clubs, and I think you see the same thing today. For me, study club learning is really valuable. The main thing, what it does, honestly, it allows the members of the study club to drive the curriculum. I can go to courses, but you know what? if it's a 3-day course and one of the days is something I'm not really interested in, I've already had a lack of efficiency in my continuing education process.
Right.
Where I took a day out of the practice or a day away from the family and paid for it and paid for the transportation and the hotel and the meals. So all of a sudden now the course isn't quite as valuable in terms of return on investment in your practice as one where you can direct the curriculum. That's the nice thing about a study club. There's really no fluff. We had our Chicago Study Club last Thursday and Friday, and from 8 to 5 on day 1 and 8 to 4 on day 2 was all strong material, and basically it was all the stuff that the people in the study club had wanted. So you can really, I know with study clubs, you can have a far more efficient continuing education experience than just going to meetings.
Yeah, I love it. Completely agree. So I want to know, what's question number 4?
Question 4 goes back to finances. Now that you know what you're going to do, how much are you going to charge? In order to be able to set a fee, what do you have to know? You have to know how much it costs to open the door and do business.
Right.
You have to understand your BAM. You know what the BAM is, Kirk?
Bare ass minimum. That's been around forever.
I was going to let you say it, not me, so I didn't get in trouble with you. What does it cost to open your door?
Right.
Now, that's not the home supplies that you pass through when you go to the Costco or Walmart or something. Do an accurate accounting of your practice and see what it really costs to run your practice. Don't include any owner compensation in any way. Not health care, not retirement, not personal expenses, nothing. Figure out and work with your accountant on exactly what it costs to run your business. Figure that out on a per hour and a per day basis. And I think if you do that, that gives you a better understanding of how you need to be able to set your fees. I think we were never taught to do that, so most of us don't do it. It's funny, I will ask dentists that question, they're like, I don't know. And it makes it difficult to have a logical approach to the finances in your practice because you're working off emotional information. I've never said that before. Does that make sense?
Makes perfect sense. Very well said.
That's really what we're doing. It's emotional information.
Right.
This fee feels right. Well, why does it feel right? Well, it feels right because my buddy down the street was charging that when I asked him. Okay, well, how did your buddy down the street set the fee? He probably set it relatively close to usual and customary that the insurance companies set because they don't want to have the discussion with the patient why it isn't covered. Does that have anything in any way relate to what it costs to run your practice? No. So, as a result, most of the time when we set our fees, even if we're fee for service and not in network, it's pretty close to what the insurance usual and customary fees are if you really look at most practices.
Right, I agree.
I think the mature fee for service practice will truly have a time and materials fee schedule, which I think is a more fair fee schedule for the patient, quite honestly.
Yeah, there's so many. Yeah, the fee thing is so important, and you do. I mean, you need the help of either a mentor, a coach, even an administrative expert. I mean, we could even go into. Sometimes people have the right fees, but they don't bill them out, and so you need to be charging your full fee every time, and it's got to be logically created based on, also expertise, time, expertise, skill, judgment. There's so much to unpack there. I have so many thoughts.
Well, here, let's go back to this for a second, because ultimately, when we look at our fees, it was interesting because we did a fee survey for Chicago Study Club last week, and we have some network dentists and some non-network dentists. The network dentist set in fees that were the actual fee they got paid, and then the network fee that was charged. And when I talk to dentists, a lot of times who are in network, and we talk about production, they're giving the full production number. My point is, I don't think that's an accurate way to assess the practice.
No.
The numbers really have to be, doesn't matter what you produce if you have to write off a third of it. Your real production is a third off the full production number, because that's ultimately what you're getting paid.
Yeah.
So I think sometimes we need to bring a little reality into the numbers today, and sometimes we see some inflated numbers that really don't match the collection numbers in the practice because of the arrangements with an insurance company. Now, I'm not saying that's bad in any way, but I'm saying when we look at the practice, we need to look at accurate numbers, I think, to really, again, make an informed decision as opposed to an emotional decision.
Totally agree. And this is for another conversation, but Barrett mentioned this on Friday in our To the Top Study Club. People say, well, I have a $1.5 million practice, but they write off a third. No, you don't. You have $1 million practice. You know, like it's not apples to apples. So I think all of that's got to be in consideration, and your fees are a huge part of this. And you're right. You said the magic thing. I mean, most of the fee schedules we see are dictated in some way by insurance somehow, and you have to unlink those eventually.
Right.
So, yeah.
Absolutely agree.
So give us question number 5 when it comes to next year.
Well, number 5 is an interesting question. All right, so number 5 is, now that I know all this, I know what I'm going to do, I know what I'm going to charge, and I'm going to staff the practice, I know how many square feet I want, how am I going to get patients to come in the door? Well, the obvious way now, and what you see a lot of young dentists doing, is joining an insurance plan. I mean, you know, you talk to young dentists getting out of school, that's what most dentists will start out with. And there's a lot of pros to that. Problem is there's some cons to it too. The pros is you have patients. I mean, you've got patients coming to you and allows you to fill empty chair time. The problem is they're unfiltered new patients. Let's call them that. Frank Spear uses a great term called filtering. And really, when a new patient calls the office, Frank says, would you like this to be more of an emergency exam, or would you like this to be more of a comprehensive exam? It's a real easy way to have the question. And some people just want an emergency exam. And some say, no, I've got a problem with a tooth on the upper left, but I'd like you to take a look at everything. The goal, I always think, is to build a patient base of people who value dentistry.
Right.
In terms of Pankey terms, that would be called above the line. Below the line are ones that don't value dentistry. Unfortunately, one of the cons of an insurance-based practice is sometimes you get people who are just there for the money and they're not really interested in the dentistry as much. Not a value statement one way or the other. Some of my best friends are like that. Some of my family members are like that. So that's not good or bad. That's just the reality, because as a business person, here's the key. You only have 28 hours a week to allocate. Your homework should be to go home and get your schedules for the last 2 weeks and the next 2 weeks, and take 2 color highlighters. Highlight the patients who value dentistry in one color, highlight the patients who don't in another, and figure out the percentage of time you're spending with above the line patients versus below the line patients. If your practice is too busy and 80% of your time with below the line patients, your practice isn't too busy. You need to rearrange how you're seeing your patients. If you're busy with 80% of the patients above the line, then you got a good problem.
Right.
Then you might want to think about getting bigger. That might when you want to start thinking about bringing someone in the practice if you decide you want to work with someone. But that's the thought process.
Yeah.
The problem with insurance-based dentistry, though, is honestly it's harder to treat more complicated cases.
Right.
Problem is because there's a ceiling on your fee, so there's a ceiling on your time. If it's an easy case and there's not a lot going on, pretty much no problem. If it's a complex TMD case, if it's a complex restorative case, if it's a case that requires treatment planning, those cases are harder to get paid for in this practice model. So either we have to try and not spend as much time on a complex case, which we all know how that goes, or we spend more time with the complex case, and then we can't accept the fee with gratitude because we don't feel like we're being paid for the work we're doing.
Right.
L.D. Pankey defined a fair fee as a fee that the patient paid with gratitude and the dentist accepted with gratitude. The problem is many young dentists can't accept the fee with gratitude today because they don't feel like they're being reimbursed for the work that they're doing.
Yeah.
That's ultimately why you tend to see a low level of enjoyment or fulfillment in that. And that's why a lot of times after 2 to 3 years, you see young dentists leaving those practices.
Yeah.
That's the clinical reality, what you're seeing today.
Yeah. And Jim, I love that you've never shared that on the podcast before. The exercise 2 weeks prior, 2 weeks ahead.
Yeah.
People, I think we could do a whole podcast on that one. Now, if you're listening, listen where Jim came from marketing, because a lot of people will start with like, I need to improve my website. I need to, spend some money in this department. We need to up our game in our photos. All that stuff is important, but not nearly as important as deciding who's above the line and below the line. Can you just open that up just a little bit more? Why would that exercise help me determine how to market in the future?
Well, because above-the-line patients are more likely to refer above-the-line patients. Below-the-line patients are more likely to refer below-the-line patients. That's the reality. So when you look at scheduling, it's kind of like being a frequent flyer for American Airlines. If I'm a 4 million mile flyer, I don't want to get bumped by someone who's never flown American before.
Right.
And yet we have patients who have been with us 20 years and spent thousands of dollars on treatment with us, and we make them wait because we have an emergency on someone we've never seen before. It doesn't match the experience.
Right.
The goal is to build an above-the-line patient base. And quite frankly, that's what we did over the years. Now, I didn't start with one, but there is absolutely no doubt that the greater the percentage of above-the-line patients, the profitability of the practice increased, the stress of the practice decreased, the longevity of the staff increased, and it was a far more fun place to work. That's, I think, the big picture issue. Rarely did we go home not in a good mood from the office.
Right.
There may have been issues. I'm not saying there wasn't. It wasn't Disneyland. But I mean, when you look at the two styles of practices, there's no doubt that building a patient base of people who value what you do makes your job easier. No doubt.
The cool thing, no doubt. The cool thing about the treatment plan you just put out there is you might do the exercise Jim just talked about, and you're like, wow, 30% of my week are people above the line. Well, go to 40%. Then you go to 50%. It doesn't need to be perfect. Once you get to 60%, everything changes. Your joy, your profitability, your dentistry.
It's just this, I heard Pete Dawson talk about slow, steady progress in each part of your practice. I heard the steady and I heard the progress. I didn't hear the slow. The slow's the hard part.
It is.
You know what? It doesn't have to be changed tomorrow. This is an awareness. This creates awareness with your staff. This is a process. It's a doable process, but make it an easy process. I had a guy who I knew who went home and implemented everything that he heard. He lost a third of his practice. The rest of the story is he had 9,000 patients, so he could afford to lose a third of his practice. I had about 100 patients when I started. I couldn't lose a third. So my implementation was maybe a little slower than his, but it was easier on the stomach lining. You'll know what pace to implement. Just start making the changes. The first step of implementation, honestly, is a new patient exam. And, that's probably really, we should do a podcast on that maybe next, as a new patient examination as a way to change your practice.
Yeah, let's totally do that. Absolutely.
Now, you could do that. Option two, you could internally market to existing patients because we're trying to bring patients in the door. So you can send out a newsletter. I did that. The problem is it's limited. You've got a limited number of people you can do that for. If you're going to internally market, you got to make sure they've had a repeated positive experience. They were seen on time. They had good clinical care. You've got a clean office. You've got a friendly staff. They have clear financial expectations. If you don't have all those things, it's difficult to internally market. So make sure you have all those things. The older you get, the more difficult it becomes to internally market because a lot of those patients have already referred patients. Option number three, you can externally market to people you don't know. It used to be newsletters back in the day with direct mail. Today it's social media. You can bring in a lot of patients this way. Again, you're a little uncertain of the patients you're bringing in. You need to be able to filter well. You're going to have a higher percentage of people who are below the line that may be shopping or may have unrealistic expectations. So you have to have a front desk person who is trained in filtering. And the reality is maybe you're going to do all this. Option four is you position yourself in your local community. Coach a baseball team, run the Lions parade, the Halloween parade for the Lions Club, join the Downers Grove Chamber of Commerce. I did all those things. It was enjoyable. It was a good way to meet people. It gave me experience in group leadership, but it's a little time intensive and it's an uncertain return. It may take years to reap the benefits. So just know that everything has a piece. I'm going to tell you, I think the most effective way to do it is to position yourself in the dental community.
Right.
If you can do that, you have a constant stream of mostly above the line patients because they're being referred to you for a reason. A lot of times those patients understand that insurance may not cover that. You have an unending stream of dentists who are looking to refer. So your new patients and your marketing, I hate to say this, we never had a website. Honestly, we were busy. We didn't need one. So today, I know that's not realistic, but the other side of the coin is you'll tend to do more complex cases, which means you're going to need really good diagnostic records, which means then you can charge a fee for that, which leads to the restorative diagnostic practice model, as Kirk talked about at the beginning, where your assistants outproduce your hygienist. You have increased case acceptance, you have decreased stress and increased enjoyment. Problem is you got to do some things in order to make this work, though.
Right.
You have to commit to staff training on a regular basis. You have to have clinical quality, internal quality control from a clinical and a managerial perspective. You have to be on top of it. It's doable. You just have to know what you need to do, though. You have to maintain good communications with patients, referring doctors, and staff members. But most of all, what you need to do is to develop a skill set to attract the patients. Let's talk about what the skill sets are.
Let's do it.
You have a number of different skill sets today that will attract patients to a general dentist practice. Might be aesthetics, it might be fixed restorative, it might be removable restorative, it might be surgical implant placement, it might be restoring implants. Could be orthodontics, it could be periodontics, it could be endodontics, it could be pediatric airway, adult airway, oral surgery, pedodontics, orofacial pain, or TMD occlusion. So basically, those are the 12. There's probably other things in there, but that pretty much covers most practices. So the question is, which of those will have specialists that will also do that? So when you take everything else away, there's really 4 things that a general dentist can do to attract patients to their practice from a skill set perspective. Number 1 is aesthetics. You can stack you. There's lots of dentists throughout the country who have established a practice based upon aesthetics. Patients do have high expectations, and it does take a long time to develop a referral base. It is elective treatment, so it is sensitive to economic downturns. Those are the pluses and minuses. The next is pediatric airway. You can be busy doing pediatric airway. The problem is it's difficult to charge a diagnostic records fee that allows you to maintain a profitable practice. And you have increased staff members because you have two assistants now, because a lot of times these patients are between 1 and 5 years old. Creates a lot of chaos in your office. You have to be okay with that. But you need increased staff because you've got little kids in there. So it's difficult to maintain a profitable practice. You can have adult airway. You have to know you're going to be treating a lot of times medically compromised patients that probably have skeletal growth issues. If you're going to do appliances, you have to maintain those. Sometimes you have to be working with medical insurance, which is really difficult. Bottom line is we're not sure how they all work. Some people love appliances. Some people don't love appliances. It's difficult to implement. You see a lot of people who do airway for a while and then phase out of doing it. A lot of people say, I had to basically stop doing it because my profitability was plummeting because I wasn't doing anything else but talking to patients.
Right.
Now, I don't want to point this out and make it negative. That's not my point, because there's been a ton of dentists who have helped millions of patients with airway issues. But you have to understand this is a unique practice style, and a lot of people have tried, and it doesn't work real well. I'm going to tell you, basically, there's 3 airway treatment options, if you make it real easy. 2 of them are indirect, and 1 of them is direct. The first one is a CPAP. That's an indirect option. The second is a sleep appliance. That's an indirect option. And the third is a double jaw surgery, where you move the lower jaw forward to create a larger airway space. That's a direct option. Mark Piper made a comment many years ago that I will always remember. He goes, what can a dentist do for an airway patient? Basically, what they can do is they can increase the exoskeleton. We can make the bony housing of the airway space larger. That's all we can do, though. That's the problem why it's an uncertain treatment, because there may be breathing issues on top of exoskeleton issues that we can't control. Now, the problem is whether you do option 2, which is the advancement appliance, or option 3, which is a double saw surgery, you have to understand joint anatomy. So the last way you can bring people in is through understanding TMD and occlusion in your community. It's the most unique skill set there is. And no one else wants to do it.
Right.
So really, it's the fastest implementation potential. You have a potential for a huge referral base, and it's easy to build above the line patients. You automatically get brought into an interdisciplinary treatment planning thought process, so you work with the best specialists in your community. Here's the interesting thing. Once you are able to stabilize TM joints, I always thought that I would have to send the patient back to the dentist to do the restorative treatment. 99% of the dentists who referred cases for joint problems didn't want to do the restorative afterwards. So what it did, it infused a ton of restorative dentistry into your practice. There's a high option for profitability in this type of practice, which is why really the restorative diagnostic practice, I think, if you can develop this the skill set to diagnose and treat occlusion and joint problems, it's the fastest way to build it. It's the most predictable way to build it. And it's the best practice model to build.
Yeah.
So those are my thoughts on the 5 questions.
I love it. I want you to give us a final thought on the 5 questions. And then I want you to talk about your study clubs, because I know people are going to want more about it. But give us some final thoughts, Jim.
Well, I think, again, any dentist at any age really would be a great exercise to go through and answer those 5 questions. Because it really sets the tone for your practice. It allows you to go to work every day in an environment that you enjoy. It allows you, I think, to give patients options that many times they don't get normally. I see a lot of dentists who have a lot of debt coming out of school. And a lot of times there's a pressure to produce. So many times we have to do as much dentistry we can, and it becomes kind of a scarcity mentality, kind of a panic-based treatment planning mode. Patients hear that in our voices. You know, Dr. Pankey made a statement many years ago, it can never be more important for the doctor to have the patient accept the treatment plan than it is for the patient to have the patient accept the treatment plan. Another line was, it's always easier to go into a consultation with a few dollars in your pocket.
Right.
Keep your personal expenses as low as you can when you start, but offer people choices. Ultimately, what I realized is I couldn't offer people choice until I had choice in my own life. So my advice to you is to live frugally as young dentist and try and put some money away. If you can do that, it'll give you a sense of, I don't want to say relief, but it'll give you some cushion in case you have a slow month. And, you know, when we started, I had a lot of slow months, and I did not come from financial means, so this needed to work. So I guess I wish I would have heard these 5 questions earlier, because I think it could have clarified my thinking to what I could have done earlier in my career. Having said that, I will tell you that those 5 questions, I've had the really unique privilege to work with a lot of dentists over my career. The dentists that answer those 5 questions and set the practice up the way they want to do it generally do pretty well in dentistry, and they generally enjoy what they do.
Yeah, totally agree. Totally agree. Jim, this is brilliant. I hope if you're listening, like, pay attention to these questions, ask these questions, and then answer these questions, and it'll just give you more and more clarity. I know that there's a lot of people that are going to be listening and want to know more about what you do. Where can I find more of Dr. Jim McKee? Give them tell them where to go.
I teach the Advanced Occlusion Workshop at Spear Education, and I teach the Occlusion Seminar with Frank Spear and Greg Kinzer. We have a seminar in April in Scottsdale, and the workshop is July in Scottsdale. The seminar is a 2-day seminar. The workshop is a 3-day hands-on combination of treatment planning, exercise, and clinical skills. We look a lot. It's imaging. It's an awesome 3 days. You'd enjoy it. It just depends on where it fits in your practice, quite frankly. For me, I think it sets the foundation for restorative treatment planning, because really, I can't make occlusal decisions until I know how the load is being distributed at the back end of the system. And really, there's not a lot of people talking about it today, unfortunately. Mark Piper was really the doctor who championed these principles, but Mark's been retired for a while now. So really, we need to pass these concepts on. So the goal is to have as many dentists learn them as possible so they can share it with the dentists in their community. I have a study club program called the Chicago Study Club Program. I run that with 3 other dentists, Kurt Ringhofer, Seth Atkins, and Drew McDonald. It's 4 days a year, 2 in the spring, 2 in the fall, and it's always in Chicago. We've made a decision to keep it in Chicago to try and make it as easy for people both on the East Coast and the West Coast. A lot of times the teaching centers have even been in Florida or Seattle, so we're trying to put something in the middle of the country that makes it easy for both people to get there. So if you're on one side or the other, you don't have to travel a full day to get there. Right. And Chicago's pretty much a direct flight for most people, or at the most one connection. It's a 2-day study club / workshop. That's a lot of hands-on. We do limit it to people by invitation only. So if you want information, email me and I'll be happy to share that with you. The reason is because we want to have a really top-notch learning experience. Everyone in the club is either known one of the four of us, or we've worked with them on cases. So it's an awesome group of people. If you want more information on this immediately, Phelan Dental Seminars has a TMD module. Stephen Phelan's a dentist in Toronto, and I really have to compliment Stephen. He is so far ahead of the rest of the group in continuing education. And this is all virtual. And so what Stephen does, he puts together I did a 10 module course for him, and I broke each module into 8 questions. It's a really complete, both managerial and clinical aspect of how to look at TMD restorative cases, how to implement this into your practice. I think it's a very effective teaching module. So if you're looking for information there, Phelan Dental Seminars will get you that. I just finished the last module, so Stephen typically raises the price after the course is complete. So if you want to save a couple bucks and you're interested, I'd pick it up sooner rather than later. Stephen knows how to sell these, so it's interesting to watch this.
He does.
But it's an awesome teaching modules. The modules will cover the common question that we see on an everyday basis. So if you're looking for information, that's probably the quickest way to jumpstart it now.
Yeah. Jim, I can't thank you enough. And if you're listening to the podcast and you're not taking notes, don't worry. We're taking notes for you. So you can flip up to the show notes wherever you're consuming this podcast, and you're going to see links to everything Jim shared. And you can click the link and go straight there. Jim, as always, I'm so grateful for you, brother. Thank you for being on today.
Thank you for the opportunity, Kirk. It's always, like I said, I really enjoyed the time we have together doing these podcasts. So thanks so much.
Oh, it's my pleasure. I have like 12 more questions on what we were talking about today, but we're going to have to save a lot of those for the future podcast. So
save them for next time.
I will. I totally will. So stick around while we say goodbye to everybody else. But thank you guys for listening to the Best Practices Show. If you enjoyed today, do us a favor, hit the share button, share this with your friends. We're just so grateful to have this opportunity. The podcast keeps growing. So whatever you guys are doing, keep doing it. And I'm going to have Jim back again and again and again. So until we see you guys next time, or you hear from us next time, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.